the Alabama Obesity Task Force. And so, and we're a free organization, and probably our name doesn't reflect what we do. And we're pretty much a health promotion, nutrition, physical activity task force. We just don't deal with nutrition. We deal with trying to get people healthy. And nutrition, it started out with nutrition. That's most of the members in the area of nutrition, but we have businesses and lacrosse and AARP and all kinds of people that take part in that. And we come together and do some things. The people that do the day-to-day work are Kathy Briggs, Allison Hoyt, Sheena Gregg, and Molly. And so we're on the phone together, or conference calls or whatever, pretty much every day, working on the day-to-day operations. Then we have some committee chairs and so forth. So it's a lot of fun. So see, I even got my picture made with these pretty girls and stuff. So so you recognize Molly and Allison and Sheena and Kathy and so forth. This was at the Alabama Cattlemen's Association. That's where we had our last meeting there. So see, we have lots of fun at our meetings, and this was a snapshot at our last meeting. Did y'all see all this? Okay. Okay, and so I'm going to give you some stats about, is that better or worse? You can see? Okay. And so y'all probably know these numbers, but the CDC numbers, we're rated the fifth worst in the country in terms of obesity. And so we were eighth, and then we're fifth. But you have to look at these numbers because there's a certain amount of error associated with these rankings. And so if they did it again tomorrow, we may be seventh or maybe third. And they say you can't compare the numbers now to anything past 2011 because they have a different way of collecting this data. And so it's a basic estimate of how we rank in terms of states, in terms of obesity there. And then if we look at kids, well, we rank 20th and then go to 11th and then 3rd. So as our kids grow and get older, we tend to do worse compared to other states in terms of obesity, which is not good. And then this slide shows that in Alabama we have almost 500,000 diabetics, and we have over 1 million people with hypertension in Alabama. That's really sad, really sad. That definitely relates to the obesity problem that we have in Alabama. And so here it says 4th, but most of the data shows that we're number 1 in terms of the worst state in terms of diabetes. Now, if you look at life expectancy in the United States, here we are, and all these are other countries that are ahead of us. And so if you lived in Japan, you'd live a lot longer than us and so forth. So we don't do very well in terms of other countries in terms of life expectancy. But then if you break it down based upon states in the United States, our average lifespan in the United States, in Alabama, is only 75 years. In some of these other states, it's 80 years or 81 years. And so if you want to live a long time, move to Hawaii or move to New York or California or someplace. And so they do much better than we do in Alabama. And I think and I'll show you some reasons why I think that's true. And so lifespan statistics, again, based upon states. Here we are. Here's some of the other states. So we're about 75 years, and the top up there is 81 years. So there's a big difference in terms of how long our people in Alabama live compared to other states. And then, now, we also have a lot of folks in Alabama that do no leisure time physical activity. And so about 1/3 of the people in Alabama don't do any physical activity at all. And that's probably underreported because I think if they called you on the phone and say, do you do any physical activity, you probably would be embarrassed to say, I don't do anything. And so you probably say they do something, but a third says they don't do anything, which is really, really sad there. Then look at diabetes rankings by state. Okay, here we are. And so we're off the curve in terms of the number of diabetics in Alabama compared to other states. So lots of diabetics, and it's going to cause some serious problems as time goes on. Now, what I did is I took the CDC data and I graphed it. And I don't think anybody else has done this, but I looked at obesity rankings by states. All these are different states, and then no leisure time physical activity. And what we see is the more no leisure time physical activity, the higher the obesity rate. Okay, it's a straight line. I never figured it would be like this, but it's a straight line. And I'll show you some other graphs really quickly that show the same thing. Obesity relates to 150 minutes of aerobic activity, and so people that do more aerobic activity have much less obesity. So the active states, the active people have much less obesity compared to the inactive states, where the blue bubble right there. Relationship between diabetes and obesity. This is Alabama. We're off the chart. We're an outlier here compared to other states here. And so we're way up here in terms of number of obesity, in terms of diabetes and obesity, which is really, really sad there. Okay, then if you look at the Nurses' Health Study, it shows as your BMI goes up, BMI of 35 or greater, you have a 40-fold or 4,000% greater chance of becoming diabetic. That's a pretty big number there in terms of risk of diabetes there. And then people with diabetes, how long can they expect to live? Well, I couldn't find this data for the United States, but I found that with type 2 diabetics in general, now if the type 2 diabetic takes care of themselves, does the right things, they can have the normal lifespan and so forth, but if they don't, their lifespans are about 10 years less than the average person there. So that's a pretty big decrease in lifespan related to diabetes. And so this looks at the relationship between 150 minutes of aerobic exercise and longevity. And so we know that the guidelines, the national guidelines, are 30 minutes a day of physical activity, 5 days a week. And so if you do that, you meet the 150-minute guidelines. And the states where the people meet those guidelines, they live a lot longer. The states where they don't, when they're not active and don't meet those guidelines, their lifespans are a lot less. I never thought I'd see that on a graph to line up exactly like it has lined up. But all the data from all these states, the correlation, if we do the R-squared and so forth, it shows statistically significance between physical activity and longevity. Just 30 minutes a day of physical activity there. Relationship between longevity and diabetes. If you got diabetes, most diabetics in our state look at our longevity. We just don't live as long as other states. You have fewer diabetics. So I think there's a strong relationship there. Relationship between diabetes and 150 minutes of physical activity. So the people that do 150 minutes of physical activity have a lot less diabetes. People that do less than 150 minutes have a much greater percent of diabetes in their states there. So these are pretty powerful numbers here. Relationship between diabetes and muscle strength shows that if you don't like to walk, you can at least go to the gym and do some resistance type of exercise, or gym exercise, or Zumba, or something, whatever you like to do in terms of physical activity. So there's something for everybody in terms of physical activity there. And so the 150 minutes of physical activity is what I recommend. Look who else recommends it. The Heart Association, the CDC, the President's Council, the American College of Sports Medicine, and so forth. And so the 150 minutes of physical activity per week is pretty important related to the statistics that I've previously shown you there. And so what's the secret? How can we get people in Alabama more healthy to prevent diabetes? We can just get them to move.